Thanks, Elwin.
There is a push tonight to give more Georgians access to health care and health insurance. Experts estimate right now 500,000 people in our state may not have insurance.
Tonight, Governor Kemp says he wants to expand Medicaid benefits, but he insists it will be limited and consistent with conservative doctrine. 11 Live's Doug Richards explains what would change.
Georgia Republicans, led by Governor Nathan Deal, had declined for years to accept federal money to expand Medicaid. But times change, and now Governor Kemp says he wants to see if there's a way to accept that money at least a little bit. Kemp took a lot of heat for paying scant attention to health care during much of his campaign. Now he says it's a top priority for him as governor.
This is a big step, but a big step is needed. I mean, we're at a crisis with health care, not only in our state, but in our country.
Kemp wants to explore a Medicaid waiver under the Affordable Care Act, designed to expand access to health care and access to health insurance. It would specifically target issues of mental health care, opioid addiction, and infant mortality, but Kemp's staff says everything but full Medicaid expansion is on the table.
We're going to focus this on Georgia.
It is not about Medicaid expansion. What it's about is trying to get free markets and private insurance to cover as many Georgians as we possibly can.
Healthcare interests make regular appearances at the Capitol, many of them lobbying for full expansion of Medicaid. Kemp does not support that. According to an 11 Alive poll last fall, 70% of Georgia voters do.
Sometimes change at the General Assembly is incremental.
Elizabeth Apley has been lobbying for years for Medicaid expansion. She says Kemp's bill is a step forward.
We're excited to see Georgia moving forward to increase access to health care, and we'd like to see that as strong a model as possible.
In your view, is a partial Medicaid expansion better than no Medicaid expansion?
Well, certainly covering more Georgia citizens than we have now is something that's better.
Democrats say they still want full Medicaid expansion. Kemp's bill is a little short on details. It proposes hiring a consultant to see if there is a way for Georgia to expand health care access in a way that Republicans will accept.
All right, Doug Richards, thanks so much.